Okay, so thanks for joining our first webinar in the series. And I'm going to do a little bit of introduction, then we're going to move on into our content for today. Our guest presenter today, Pam Shea, has been working with mothers and infants for over 20 years. She's a former labor and delivery nurse and has focused many years on educating and supporting families with twins and triplets. She has a love of developing and teaching prenatal classes and helping to support breastfeeding moms. Deb Zalvin, our Executive Vice President, has been at UbiCare for 10 years. She heads up our marketing efforts and leads our work within the Department of Defense. Previously, she designed museum exhibits and worked in technology marketing, all of which have allowed her to dig into her passion of engaging and educating people through non-traditional methods. I'm Jo Charest, Director of Client Success here at UbiCare. I've been working in client success within the technical healthcare arena for about 15 years. Primarily with hospitals and home health organizations. My background is in nursing, including military and hospital practice, as well as technical support and account management. All that provides a great foundation for understanding client goals and initiatives and supporting them through our SmartXP platform features. Today, we're going to share some information and experiences to show you how you can tap into the power of the platform to achieve your goals and initiatives for patient engagement. We'll hear from Pam first, who will provide some insight on how the Northwestern Memorial Health System is utilizing their program. Deb will share the science behind the program and how it works to engage and keep your patients involved. And finally, we'll get into the nuts and bolts of the platform, where I'll point out some of the best features of the messaging and behind the scenes data insights. If you have any questions during the presentation, please feel free to add them to our chat box or hold on to them until the end of the demo, and we'll be happy to answer them. You're as important to these webinars as we are, and we look forward to hearing about your successes and challenges and working together to make us all better. So I'm going to hand it over to Pam.
So thank you. If you guys cannot hear me, let me know. Otherwise, I'll assume that you can. And I'm going to go ahead and start by telling you a little bit about what Northwestern Medicine, or how we use the platform. We call it the NM Parent Connect, and you might know it as the Smart EXP. So in our system, we have 8 hospitals, plus 1 children's hospital and 1 rehab hospital. NM Parent Connect is in use at 4 of the hospitals: Central DuPage, Delnor, Lake Forest, and Prentice Women's Hospital. I happen to manage the platform at Lake Forest and Prentice. We also have information about our children's hospital in the messages, so that if patients need it, they think to come to us. There's quite a bit of talk about patients becoming consumers, and it's true. Patients are consumers of the healthcare of the healthcare that our hospital offers. So it's important to listen to what our patients want from the hospital. On the right, you can see some of the reasons our patients have told us why they enjoy our engagement tool and why it makes their hospital experience better. They like that it's interactive with questions and quizzes. They trust it because it's evidence-based and it comes directly from us, the hospital. It's also really important for Northwestern because it means that all of our patients at the different hospital settings are getting consistent information. Patients like that it stays with them for 3 years, so we're not just preparing them during their pregnancy, but we're supporting them for a long time after they deliver, and it really makes a difference to a new mom's life, and it helps them feel positive about our hospital. Patients have also said that they like that even though it's free, there are no ads like many other free services they could enroll in. It also sets their expectations for their pregnancy, delivering at Northwestern Medicine, and their child's development. This is a screenshot of a monthly report from the hospital. I find it helpful to review the data and see how many patients we have reached with the emails. I've shared this data with the physicians to discuss the connectedness to the hospital, and also I find it very interesting that in all of the reports, at least 90% to 100% of the responses say that they take better care of themselves, and they also take better care of their child after receiving these emails. The automated interactive educational messages that patients get are how most of us think about what I call the NM Parent Connect, but there are other ways to take advantage of the tool. The other features can let you know how patients are doing and also make your job easier as well. We set up a survey to send to women postpartum that asks about our classes they attended at the hospital. So we do get surveys after every single class, but what we wanted to find out is how the classes are affecting them during their delivery, and are they preparing them better for once their baby is born. This has given us insight into what works and what needs to be improved in our prenatal classes. For example, we found out that the patients loved our hospital tours and that it was one of their favorite parts of the classes. We shared that information with our instructors, and we make sure that they emphasize the tours in classes, and they've actually been able to elaborate a little bit more into detail when they do the tours because patients are so engaged. We also, through these surveys, identified inconsistent teaching practices. So we make sure now that our teachers, our educators in classes, the nurses in the hospital are all sharing the same hospital-approved information. And this really did go back to kind of swaddling and related to what we teach in class and making sure that it is indeed a consistent message once the patients are up on the postpartum unit. At this point, our patients enroll themselves. We are considering auto-enrollment, so when patients register for their online classes or register or pre-register for their delivery, we're considering the opportunity to have patients automatically enrolled in our Parent Connect. However, at this point, that's not how they enroll. So it's all active on the patient's part. I kind of broke it down as 3 ways that our patients can enroll. They can enroll on our website, or they learn about the class, they learn about the Parent Connect in our classes, and we also partner with doctors' offices. So our patients usually register for their delivery as well as for prenatal classes on our website. So we have a nice banner that our marketing department created on the website in a couple of different locations, which encourages active enrollment. And that's one of the ways that our patients are able to learn about the product and enroll themselves. Also, in all of our prenatal classes, each class has a PowerPoint slide and a poster with the text number and code. The instructors discuss the product, they state that it is free, and encourage enrollment. So they keep the slide up, and then also during the breaks and after class, they encourage patients, if they have not yet enrolled, to go ahead and enroll using the poster. Some of the instructors pass the poster around, tell them go ahead, text the code while they have the poster in front of them. Some instructors will say take a photo of the poster and then enroll once you get home. One of our instructors found out that if she emphasizes that it's free 3 times, patients will enroll while in the classroom. So 3 times happens to be the charm for her. We also partner with the doctor's offices. So our marketing department developed flyers for doctor's offices listing our prenatal classes. On the back side of the flyer, it includes information about how to enroll in the Parent Connect and also what it does for the patients during their pregnancy, as they have their babies, as well as through the toddler years. An easy thing to do is to have a poster in your physician offices with the text sign-up information, or to have a receptionist in the doctor's office remind patients about the Parent Connect or the Smart EXP when they sign in or check out at the doctor's offices. Also, it's important to remind patients that they can text the hospital code to sign up, so they don't necessarily need to type in the URL, but that is an option. Every hospital has a unique code. For example, ours at Lake Forest is LFIL for Lake Forest, Illinois. Joe will be able to help you if you don't know your hospital code, or you can use the chat feature in this webinar now to ask. For us at Northwestern Medicine, our marketing department designed our website banner and posters for our classes, but UbiCare can make them for you. Again, check with Joe to see what your hospital code is if you do not yet know it.
Thanks, Pam. This is Deb, and thank you all for joining us. Pam, it's great to hear your story and to hear how you've really discovered the power of this platform. And when I think about that, I think it's really about the ongoing continuous conversation that you're having with patients, and you clearly are, where you are giving them the information pinpointed to what they need at the right time, and also asking for their response and having a two-way interactions with them, and using the information you're gaining to really better the care at Northwestern Medicine. And it's really exciting for us to hear about, and to help all the rest of you to do as well. Okay, so as Joe said, I'm going to talk a little bit about kind of the science behind the platform, the program, and then Joe will dig into more specifics and showing you the admin center that you all use already. Okay, so the slide you're seeing here is really speaking to the fact that the point of care is the smallest part of the episode that any patient is going through. And we know that patients want information about their health. In fact, 72% are searching online for health information, and they forget the information that they hear at their appointments. And yet 90% of Americans are on technology, right? We all use it all the time. We use it when we're in that point of care, before we ever come to the hospital, throughout our entire recovery, and we use it to communicate and connect and get this information that we need in order to be better patients. And what this tool is doing for you is really allowing you to control those conversations and own those connections. It allows you to reach beyond beyond the four walls, where you can be interacting with patients well before they ever come into the hospital and throughout their recovery or their return to a new normal, as the case may be in some episodes like pregnancy and early childhood. So we hear from a lot of clients that they feel like they're drinking from a fire hose, and they just can't find the time to do all the things that they need to do to really provide the best patient experience and increase their patient satisfaction. And we know that there are a lot of gaps between what is happening on the hospital level and all the different pieces of an episode and what the patient is going through. And that's what this slide is intended to represent. So the blue line is what you're seeing here, really the episode of care, starting with pre-care, and then the dots indicating certain touch points when you would interact with patients. And then, of course, they come to the hospital. There are some more patient interactions, whether with you, your care team, or other teams, and then, continuing through post-care. And yet the orange line here is representing the patient's episode of care, which to them is very continuous and has, all those dots represent questions and concerns and issues that come up. And you can see that they are not necessarily aligned with when they are right in front of one of their doctors, nurses, or your team. And so there are a lot of gaps to fill in. And using technology, you can do that easily. And that's what you're doing with SmartEXP. You're filling in these gaps. And like Pam said, excuse me, about a lot of patients receiving inconsistent information. There was actually a study out in pediatrics in 2015 about new moms saying that they receive inconsistent or even often no advice from their doctors or nurses about how to care for their new children and for their young children. And when you are connecting your patients and you are communicating with them every single week, you're providing evidence-based information and therefore avoiding this feeling of patients kind of being left in the cold and not knowing how to move forward. And because it's technology, it's automatic, it's seamless, and ideally you're able to accomplish more with less time and effort. So I know that you all on the call here are familiar with these messages, and I don't really need to walk you through every bit and piece of it, but I do want to point out that the way we design these messages is intentional to increase the engagement of patients and to really try to, the minute they receive these messages from you, first of all, they're coming from you, so they feel much closer to you. They feel like somebody, they actually think that the champion is the person who writes the message, and that person is specifically reaching out to them because the message is so targeted to where they are in their care. And you're appealing to different learning styles where, some people prefer to read, others want to watch a video, others want to interact, and you're giving them the opportunities to do all of these different types of communications with every message that you're putting out there. And because it is all fully customizable, you really do own these messages. You can change any of the content that is within the storyboarded messages. And as Pam talked about, and Joe will talk about further also, you can also use this program to send additional messages or additional surveys when necessary or when you want to. Okay, so last thing here, one of the other, I think, important points to talk about when we're talking about the power of this program is that it is designed not only to be easy for you to use and interact with, but especially easy for your patients to interact with and receive and access information, and for them to interact with you as well. So they're receiving a message through email or text, and here you can see a short text that would then link them to more information. And you also can read here that there's no login required for patients. Both of these points go back to the fact that we're making it really easy for patients to access this information. The information is coming directly to them. They don't have to remember any URLs. They don't have to remember what app they downloaded. You are living in your patient's pockets and showing them that you understand their lifestyle and where they want to best communicate with you. And patients have said over and over that these are the ways they want to receive information. They don't want to have to remember anywhere and go, remember anything and go anywhere to get information ideally. And by being where they are and having the messaging so targeted to their point in care and having continuous communications, you're really able to impact their behaviors. Like Pam said, if their instructors at Northwestern Medicine say 3 times to sign up for this program, they can see a behavior change. We also know that repeating information throughout these messages week after week in different ways and approaching different subjects in different ways increases the behavior change. And that's what we're all going for here and trying to increase that engagement for all of you. So what does that mean for you? Requirements are getting stricter, and we know CMS is challenging hospitals to always be improving their quality and improving care and to be proving that they're improving it. And we're in this with you. And so we are paying attention to how having these continuous connections and continuous conversations is impacting HCAHPS and patient satisfaction and patient experience. We're also paying attention to the requirements that you all need to meet. And, one, we know a big one is providing patient-specific resources through meaningful use, and you are doing that here. And by doing that, of course, you're enhancing quality and safety, giving the right information at the right time, not preempting patients before they go online and search Dr. Google for who knows what, and or talk to their neighbor or their cousin's brother about what they did 20 years ago, even 10 years ago. We know that the science behind all of the episodes and healthcare changes so constantly. So we are maintaining that content for you. And last but certainly not least is giving you the data to document this compliance. And Joe will tap into that a little bit more, and we will get into data at one of our future webinars more. But that data, I think, it's a very important part of the story for knowing how these messages are working for you and working for your patients. So with that, that's really the science behind it. With that, I'm going to turn you over to Joe, who's going to walk you through some points within the admin center.
I'm just going to switch over really quickly to the platform. Okay, and this screen should be pretty familiar. This is basically what you see or when you log in, and you would be seeing the ones that you actually have on your contract. Today we're going to take a look at the joint surgery, which is a little bit different. Most of you have the pregnancy and early childhood series. I'm just going to pull this over a little so I can see it. Okay. But joints works basically the same way as most of our service lines do. They begin to guide and engage patient at some point prior to whatever the healthcare event is, either birth, joint replacement, etc. And they continue on to guide for some period of time following those events to complete the episode. And the autism and concussion are a little bit different than that, because they're based on something that's already been diagnosed and happened and goes from after that. So Pam had referred to patients confidently connecting with the hospital through the messaging because it's sent from the hospital. And the way that we achieve that, even though they're not actually physically sent from the hospital, they perceive this because of the branding on each email and then the consistent recognizable look and feel of each of those messages that Deb was speaking of. And the branding is basically achieved by several things that we have in here and is all customizable. The first one is the banner here. And the banner, as we mentioned, can be created by either your marketing folks or we can help with that. And some hospitals actually prefer to have different banners for each of their series. For obviously joint replacement, there's only one here. But for the pregnancy and early childhood, there's at least 3. If not more than that, if the breastfeeding is also added to that. So sometimes it helps to have different banners on those different storyboards, just so that it helps the patient differentiate between the emails that they're getting. Okay, the second one would be the champion. And the champion person is basically just a recognizable person that your patients are going to associate with. They're going to see these emails come in and go, oh, hey, look, this is the email that I get every week from Jane. So they're going to recognize the banner, they're going to become familiar with your champion, and they're going to get comfortable and start building that bond and that loyalty with your hospital. Some hospitals have different champions for each series, and some also, I've seen, will actually put a different person on each and every email. So, you know, there may be hundreds of people at a larger hospital that belong to maternal organizations, for example, where you have an OB clinic and labor and delivery, all the pediatrics people, and they'll literally put somebody different on each one of these messages so that they can introduce all of those people to make it more comfortable for that patient to come into the hospital and recognize more than just that one person. Another piece that we put in here that's customizable and branded at the bottom here would be the helpful links. In the pregnancy series, it's over on the right side, but they're here. And these are usually just a convenient list of links to places that you might send them more often, your website, specific department pages, outside sites that you might send folks to frequently. And it's up to you. You can have as many or as few as you want in here. And then again, the customizable content. So any of this in here is customizable, and you just need to click on it each area that you want to go to, and it pops up our handy editor here. So you would just make your changes here. You can change the size of the font to a headline if it's a bigger one. You can bold it, you can italic it, put bullet lists in here, and hook up links if you happen to have links in here that you want them to be able to click through and go to. And then you would just okay it down here, and it goes back and makes your changes for you. So it's really easy to do that as well. You can actually put whole articles in here. Wherever you see one of these add your content boxes, that means that you can add something. Sometimes it's images in those spots, sometimes it's content. But we've had several people do something like a class schedule, for example, on a certain week that they know is when people start actually looking for that. One more thing that I want to show you up on the messages itself is that some of you may have ethnic populations that prefer to look at messages in a different language. And we've got the Google Translate up here. So when they actually get their messages, they can click on this. I'm just going to do a quick preview here. And we're going to go to Translate. And we're going to change it to Japanese, for example. So you can see it's really quick and easy for them to do that when they receive their message. And then you could just go back to show original, and it goes back to whatever it was originally, which of course is the English version. Okay, so we are going to go take a look at what else is under this projects here. Your storyboards would be the content we're looking at, your joint replacement or autism or PEC. Also under here where you'll find your surveys and campaigns. And campaigns, just really quickly here, are basically one-page flyers. It's going to be one topic, a focus on something that you want to call attention to, or do something special to get, say, higher class enrollment, a special event, a baby fair you might have coming up, a newsletter that you might want to send out that's separate from the messaging that they get all the time. So you can use it for special initiatives. We've had it used for alerts for things like typhoon or hurricane warnings that are coming in. We've had power failures where they needed somebody to call a different phone number, so they sent out a quick campaign for that. And we've had actually somebody use it for disaster planning. So when a hurricane hit, they had a quick way to send a message out to all of their folks to make sure that they were okay and find out where they were, or if they had been evacuated after the hurricane had come in. So there's lots of different things. Just use your imagination, and it's a really great way to get special initiatives done out there. Surveys are kind of the same thing. You can actually go in. One more about the campaigns. We actually have seen a lot recently in the news about flu, and the fact that only maybe 20 to 30% are actually seeing great results from that vaccine. However, even if they have the vaccine, or if they have the vaccine, they're actually getting milder versions of the flu if they do happen to get one. So it's a good idea for them to come in and do that anyway. So we occasionally will do special campaigns for you and backload them into your system so that you can adapt them and customize them to whatever you want to put on there and send those out. So sometimes we do them for you, and sometimes we can help you do other ones if you happen to have other ideas. So just let me know about something that you want to accomplish, and we'll find a way to do that. The surveys are also here. And surveys you can kind of set up any way that you want to. You can do things like true false questions, free text, multiple choice, choose one, and set it up. A good example of the survey is somebody out in California wanted to know when the best time would be for a mom and baby class that they wanted to have. So they sent out a survey asking for, what would be your best day and what would be your best time frame. And when they got all the results back from their folks, they discovered that Wednesday mornings at 10 was like 70% of the time most people could be there. And they've been really successful filling that class ever since, because they put it at the right time that people could get there. So it's just an idea, and you can figure out other ways to use the surveys as well. Okay, so I'm going to move across to the data here and go to this tab. And there's a lot of really terrific real-time information that you can get with just a couple of clicks in here to see how the project's performing, where you might need some focus. So Pam talked about the monthly report information, taking information into her administrative meetings. And at the beginning of each month, we generate a report of data from the previous month, which includes a 6-month history of things like your enrollment, your average message open and click rates, any feedback from patient surveys that were submitted that month. So let's see, go here. And this is an example of the monthly report here. And these are actually in PDF form, so when you go in here, you can either look at it or you can download it so that you can share it easily. It gives you the number of patient connections you've made in a month, and that's basically the delivered number of messages that were sent. The messages percentage of the open rate, and then these are folks that have answered the survey that we send out so many days after they finished a particular storyboard. So you can see on this one, 86% take better care of themselves. You can check to see how more confident to take care of their, manage their own care, if they're better prepared for their appointments because of the messaging, and how they feel about having a stronger connection to your hospital, so you can see how your loyalty is building. Also, if they happen to free text response, this will give you an idea of what they're thinking. Sometimes they'll tell us how they feel about the messages, and sometimes they'll tell us about their experiences at the hospital. So you can always go in here and take a look and see. I had somebody who had a billing question and had complained about the problem that she was having, and that person, immediately they were reading their report and saw that, and were able to go ahead and contact that person and resolve it before it actually got out of hand and into a worse situation. So keeping track of what they're saying is actually really easy to do by looking at these here. Okay. So also on these, you'd be able to see a 6-month tracking of how your open and engagement rates are doing, how your new enrollment is doing, and lots of good information there. Okay, so also in the data are the indicators for your storyboard. So you can actually go in here and see how those are performing as well. For example, this one is for pregnancy and infancy series. You can see that there are 21 active subscribers, how many messages are delivered, and this is cumulative over time. And then what your average over time rate is for opening and engagement. You can actually get even deeper by clicking in that box, and it pops this up for you, so you can see what your percentages are for delivery and open and engagement compared to what the industry average is. So in this particular case, they had 7 messages that were opened for about 18%, and of those 7, 67% of them engaged by clicking through at least one link in those messages. And you can see the industry average over here in comparison. Okay, also in here, you can tell how your campaigns and surveys are doing by the same thing. You could see how many of them, right now there's not any here, but it would also show you the same types of things. And you can click in and see that as well. Okay, also in here is the documents button. And in the regular series, it's not going to show you here, but in the regular series, it's basically going to give you a list of, say, reports that you've downloaded. You can do an export of all the patients in your database, for example, or if you import files, CSV files to enroll subscribers, you'll be able to track them in that documents folder as well. Because this is in the secure platform and you don't need to worry about PHI getting out anywhere, this is also a great place to upload and store documents that you need to share with somebody else who's on the platform. For example, occasionally we'll get emails that route to us through support or as a do not reply message where they're asking for something. Of course, we can't answer all those questions, so we will save them as basically a screenshot file, and we'll put them in the documents folder and alert you that they're there so that you can go in and address those questions from your patients. So that's a great feature to have in there. Okay, I'm going to move over to the subscribers tab. We'll take a look at what's in here. This is basically your database. So all of the people that you've subscribed are going to be in here. You can see At the bottom, you could track how many there are. These are from early to late, so the most recent ones that you have enrolled are going to be toward the end. You can do a search either by name here or your email address. You can also go in here, choose a particular project, and then find out how many people you have that are active, graduated, unsubscribed, bounced, so you can kind of get a good idea of how many folks are in here. This is an overall up here in the left. That's how many subscribers are in your system, and you'll see them all listed underneath that. And just by clicking on search, it will pull up that there are 21 active subscribers in pregnancy, and that's how you can kind of take a look at that. Let's see, you can add a new subscriber here by clicking on new. You choose the service line. You put in the email address, the first name, the last name, and then whatever the event date is. The joints one works the same way. And then you would just hit submit, and they're enrolled. And that's all you would need to worry about. Let's see. Now, I was also talking about importing subscribers. And that's where you can do this. So you can save your subscribers, or basically that basic information that we need to subscribe them, into a CSV file. And then you can come in here and go into imports and choose a new import. And it's going to help you bring that up into the system and upload that. So you can actually save a number of different people in there and then upload them all at the same time to get them in. That also works really well if you're pulling from your EHR system for folks that have enrolled or registered to have the baby or have surgery at your hospital. And for pediatric folks, they can actually go in there and pull the information out of new births that they've had and take those, turn them into a CSV file, and then upload them directly into the system this way. Okay. Okay. Back to subscribers here. And here's a great feature. Say you want to know exactly who's performing and how, as far as who's getting their messages and doing things. So by going in, you can search on a person, and then you can click on that person, and it goes into their profile. This is their personal information that you originally put in at the beginning. But if you go a little bit further down, you can see the date that you had put in there. So if you need to adjust a date, someone has a different due date or changes their surgery date, you just need to go in here and change it and edit it so that they get on the correct week. Over on the right here, you can see where they are. Right now they're graduated from these two, and they're active in toddler. In order to unsubscribe somebody, you just need to check on that red box there, and that makes them out. Let's see. A little bit further down, if you happen to have your Ask Me button going to our mailbox inside the platform, which is up here at the top, you can see the messages that have gone back and forth with this person by clicking in here. Underneath storyboards, you can see how many they've received in each series. And then if you click on the actual series, you can see if they've received it, clicked on it, opened it, or if it's just been delivered. So you can tell exactly how engaged that particular person is with their messaging. Same with the campaigns. And this person is apparently really, really involved. Okay, so let's see. All right, so basically those are all the things that we have. The users will just show you who happens to be signed up to use your particular platform. At this particular time, only we can add people or remove them from the users. So if you need somebody added because you have somebody new that's helping you out, or someone that you know has left and they don't need access anymore, just need to let me know and I'll be happy to take them out of there. So all this information, basically it's all right here, so you can see where you're making a difference from kind of a bird's eye view, and you can go right down into the individual subscriber interactions. So if there's anything in here that you've seen today that you have questions about, or you need more information on features or products, or if your folks would benefit from like a one-on-one session where we can go through this together and they can just ask questions, just let me know and I'm more than happy to set those up. So from here, excuse me, we're going to open it up for questions. Does anybody have any? Still muted. You didn't mute them, right?
Joe, I have a question for you.
Okay.
You talked about the flu, about campaigning around the flu, and said that you could help people to send out messages. And you talked about how we do some value add campaigns from time to time. Will we be doing another message around the flu?
Actually, yes. We were talking about it this morning, and we decided that it would probably be a great idea, considering all the flu information that's in the news right now, to maybe do kind of a booster to the first one that we sent out this year. So we will be releasing a second flu campaign, and we'll be working on that probably over the next week or so, and we will let you know when it's available in your platforms, so you can go in and make any changes. And if you're going to have additional clinics or have an ongoing clinic, you can add your information to that and choose whether or not you wish to send it out to your patients once you've customized it. Anybody else have any questions? Comments? Was this helpful? Okay. Okay, so I guess if there are no more questions, we will end this here. It's flashing up there. Okay, and if you, again, have any questions or information needed about anything, just please let me know. And I'll be more than happy to help you out with anything in the platform.
Thank you.
Okay, thanks.
Thank you. Thank you all for joining us.